The impact of the pandemic has been a little bit variable geographically, but I think there are some things that are universal. So early in the pandemic, as we were all trying to figure out how to prepare for the projected influx of patients into our health systems, one of the big things that happened was a decrease in elective surgeries. And some cancer surgeries were considered elective. So for localized cancers or low-grade cancers, things like intermediate risk prostate cancer, a lot of those things were deferred. But I think in the long run, that has probably had a relatively minor impact on sort of the epidemiology of genitourinary cancers. I think the bigger things that have happened are two things. Number one, a documented decrease in screening. So as the pandemic has rolled on, patients have become less likely to come in for sort of routine wellness visits. And it's at those wellness visits that patients tend to get plugged in for screening for prostate cancer, colorectal cancer, breast cancer. And now that we have been into this pandemic for a year, there's enough data showing that those screening tests and screening procedures have gone down quite a bit. Another thing that I think is going to affect our practices. So the three genitourinary cancers are each, the main ones, the commonest ones are detected by different means. So prostate cancer is a screen detected cancer. Bladder cancer is a symptomatic cancer. Most patients present with blood in the urine. And kidney cancer is an incidental cancer. So a patient has a test for some reason, like abdominal pain, and incidentally, they're noted to have a kidney tumor. And I think those incidental cancers like kidney cancer or thyroid cancer, or even to some extent pancreatic cancer, that's where we've seen maybe an epidemiological shift where I think patients are staying away from emergency rooms, as emergency rooms are seen as sort of unsafe areas from the pandemic. We have locally seen a decrease in the number of patients presenting with larger kidney tumors. And I worry that that's a function of decreased incidental detection and that we're going to see an influx of later stage cancers in the next year or two. We also have definitely seen fewer clinic visits as patients themselves have been wary of coming in for things like surveillance care. And that's probably most important in bladder cancer, given the rates of recurrence of bladder cancer. And so it's possible that we're missing recurrences that we could catch at an earlier stage, and missing or delaying diagnosis of those recurrences could lead to more adverse pathologic outcomes in the future.